Hello and welcome. This is Liana Lianov, and welcome to this Lifestyle Medicine podcast series on behalf of the RCSI University of Medicine and Health Sciences. And today's topic is on avoiding harm from substance use, alcohol, tobacco, and more. And I'm delighted to have with us as our guest, Dr. Steve Sugden, and he's an addiction psychiatrist, very interested in lifestyle modalities. Welcome, Steve.
Welcome. Thank you for the invitation.
Okay, great. Let's dive in. Tell us a little bit. We know that everybody knows that tobacco is harmful. What is the harm in smoking and being exposed to tobacco products?
Um, I think that there's a couple of challenges that we have with tobacco. I think the first one is um, it makes a lot of our metabolic health worse, whether it's our heart, our lungs, and I think that those would be the most risk factors that people think about. But there's also a high correlation between tobacco use and then other comorbid substance use, whether it's alcohol, whether it's then going into, experimenting with other substances. And so then it becomes more of this, people tend not to use tobacco by itself, but they tend to use it with other agents. And when you get these other agents, then that's when you start getting some of the challenges.
Yeah, well, certainly more than one harmful substance is bad, but each of them by themselves have very harmful effects. And for a long time, tobacco was the number one underlying cause for so many lifestyle-related diseases, including cancers and heart disease and some of the
Yes.
conditions you mentioned.
Mhm.
And is there anything else for our audience that they should know around the effects of smoking on certain ways that our physiology works, parts of our body, our brain, that kind of thing?
So yes, so I mean, I think that when we think about what are the harmful effects of nicotine, of course, lungs are the number one thing that we think about and how it destroys a lot of the alveolar beds within our lungs. But then it also destroys a lot of the capillary beds. And so then in all of the organs that we have, capillary organs or blood supplies to, they are at risk. And so what are some of those? Heart, kidney, liver, skin, brain, and so it's really not just one thing. It's really most of the organs in the body can be affected by it, and so what is it that if we're looking like it from a brain neuroplastic plasticity type of thing. um, there was a study that came out in 1988 where they looked at mice models, and so I'm going to use dopamine as kind of like one of those signaling markers, but we know that in the brain, dopamine doesn't work by itself. Dopamine works in conjunction with serotonin, opioid receptors, noradrenaline, epinephrine, just kind of like the whole gamut. It's all involved with, but for the sake of this conversation, I'm just going to keep it to dopamine, even though I'm want to put that caveat that it's all kind of interconnected. And so dopamine primarily is produced in what's called the ventral tegmental area, and it converts an amino acid called tyrosine into dopamine. And then it's stored in the nucleus accumbens. And the nucleus accumbens is sort of like your warehouse division, kind of like your UPS center, and it ships, it out to the parts of the brain. And so when you look at kind of a baseline function, and they kind of in these models, they call that baseline leveling at 100. When you put nicotine in it, it raised it to 2.5 times its normal level.
Mm.
And so what do we know about that is, well, the more consistently you have those higher levels of dopamine within your brain, it can then create a lot of this reward pathway, which leads into the addiction pathway. And the sad consequences out of that is that then people are looking for more and more sources of dopamine because the body tries to protect us and downregulates the dopamine effect. But then, our behaviors are such like, well, we want something more, we want something more. And so then we look for more extreme forms of dopamine. And this is kind of like what we were talking about, when we first started talking, how then there's a lot of times these combination activities. And the other part that becomes very difficult is that when you get into this state of excess dopamine modulation, people lose that ability to like something, and all they can do is focus on want. They lose their ability to have long-term goals, and all they can do is focus on the short-term immediacy. And I mean, and as a practitioner, you and I might talk to this person and say, well, can't you see what the benefits of this behavior is? And they can say yes. And then you walk out your hospital, and you see that same person engaged in the same unhealthy behaviors, right? And there's kind of like this, almost like this disconnect. It's like, well, don't you understand? And the thing is, they just lose that ability, and it just then reinforces and reinforces. And that's where a lot of these challenges then coming in as practitioners of how do we help people make these lifestyle changes or learn tools to be able to help autocorrect.
So we've been talking about nicotine, and then how is that similar or different from alcohol, excessive alcohol intake?
So alcohol has two challenges. I mean, first of all, it will work in the same way on the dopamine receptors within the brain, but then also alcohol reinforces the GABA A receptors, and GABA A receptors are throughout the central nervous system. And so again, you get this dependence or this, continued desire to want that. And especially with the alcohol use, we then notice that if somebody were to stop the alcohol use suddenly, they can get into significant withdrawal symptoms. And alcohol and benzodiazepines are two of the agents that, if you stopped abruptly, can even lead to death. And so then then we have to then think about more of these techniques of how do we provide immediate structure for somebody if they're trying to work on decreasing these behaviors, while in the meantime, how do we have these conversations about lifestyle changes? And not everybody wants to have lifestyle changes when they're in the height of their withdrawals and they feel awful.
No, yeah, absolutely. It's a very difficult, it's a challenge for
Yes.
individuals, especially because in essence, their brain has changed and they may not have that full capacity
Right.
of awareness and to take action. So it's hard enough for anyone, even if their brain was normal, just to change any behavior,
Right.
even
More
ones that
normal,
don't
right.
change our brain. Yes. So, and then can you compare and contrast to vaping, please?
So vaping is kind of like this new, I mean, it was marketed as a tool for people to help decrease nicotine use. However, when a lot of the industries found out how useful, I mean, how abundant people started making it, and how it eliminated some of the negative stigma with it, with like the smells and some of that, then it became this instant, you know, this whole talk that vaping was designed to help people stop nicotine use was, by the industry, was completely thrown out the window. And it's been highly marketed. And, unfortunately, it's also been highly marketed to teens. There's no regulation. And there's the kind of like there's the two parts of it. There's the nicotine that isn't regulated, and then there's the actual vaping pen or that heating mechanism is also not regulated. And so what we see then is if a cigarette smoke, like a cigarette, the traditional cigarette had produced so much concentration of nicotine, the vaping concentration can produce 3, 4, 5 times greater than what you would get in your standard cigarette. And so then what the challenge then is not only are we having to deal with the nicotine, but we're actually having to deal with these high potent nicotine. And, we think it doesn't cause as much problems maybe within the lungs, but we know that it then, because there's so many nicotine receptors throughout the brain and throughout the body, we're still kind of waiting to see what is that. But long term, the thought, it's harder to stop that vaping behavior, and a lot of it is just because the high concentration of the nicotine that's within the vaping smoke.
Yeah. Okay. All right. So then we talked a little bit, touched on the harms of these kinds of substances. So then the question is how to quit, or how to cut back, how to avoid some of these harms by at least lowering our exposure to the extent possible.
So, I mean, I think that's the $1 million question of how do we do that, and how do we help people live healthier lives? If I might, suggest a couple of ideas. You didn't ask me about this, but I'm just going to go off a little bit on a slight tangent. For years, there's been this talk that like nicotine is this gateway drug, that it's like, people enter in extreme substance use because of nicotine use. And although there is maybe some truth in that, if we really dial it back, what we're seeing, or what some authors are suggesting, is the real gateway drug are these ultra processed foods that run so abundantly within our bodies or within our communities, because they work on the same receptors in our brains, where we have like our endogenous opioid peptides like endorphins. So it's the same set of receptors. So in a sense, you can prime your brain with all of this ultra processed food so that it kind of gets on this quasi need for dopamine dysregulation. And then if you add agents like tobacco or alcohol later on in life, the brain's already primed that it may make it harder for that. So I think when we talk about what can be avoided, well, I think one is, we need to eat healthier, and I mean, depending upon how alarmist we would want to say, we ask for regulations for nicotine and alcohol products. Do we ask for regulations for ultra processed food products? But that's probably more than you want to get into with this podcast. I think also then we try to live as healthy as we can. And so the studies are definitely out there that show if we sleep well, we are less likely to engage into impulsive behaviors. If we sleep poorly, we're more likely to engage into impulsive behaviors. And that includes excessive binge eating. That also includes more of the tobacco and the alcohol use. Another factor of it is loneliness. We know that people who have healthy relationships sleep better. Ironically, people who have less healthy relationships do not sleep well. And so you kind of get that double dip of the sleep part. But then, we've learned in COVID what happens if somebody is isolated. Well, they tend to use their electronic devices. And we know that the electronic devices, that might be the other gateway behavior might be a lot of these media types of things. And so you can still prime your brain from either excessive gaming or excessive social media type of stuff, and it doesn't reproduce the same healthy benefits that we get from, healthy connections or engagement. And so I think two things, like from a public health perspective that we could really work on is helping people have healthy relationships and avoiding this isolation. Our Surgeon General came out with his phenomenal book about the epidemic of loneliness. And I think it's making sure that people are aware of that and trying to help engage that. And then the second part is really with the food products that we eat and really being watching over that. So I think those are two things we can do upstream to do. How do we help people make those changes if they are engaged in that? I know it's more than just motivational interviewing, but sometimes it's the only thing that we have is motivational interviewing, and trying to help people realize how we'll have the patient themselves realize what is being affected within their bodies or their health when they continue these behaviors. And if they start noticing that, then we can work on, if it's appropriate, there are FDA approved medications to help with withdrawals for some of that, but then we need to engage them. Really, it's the lifestyle interventions that are the key to helping people in my world. I mean, in my perspective, are going to give the most bang for the buck for helping people make healthier lifestyle choices.
Yeah, well, thank you for that, Steve. You pulled out a number of very important constructs that I want to re-highlight. One is that when we often think of addiction, we're thinking of substances, but an addiction can be anything. An addiction, like you mentioned, processed foods, gaming, so many other ways that our modern society now can expose us and endanger us, tempt us to be doing things that then, as you said, prime our brain for other addictions. We can become addicted to one of these and then be more likely to have additional addictions. So that to step back and think about this idea more broadly. And then the other idea is that absolutely indeed all those healthy behaviors, healthy lifestyle behaviors are interrelated. They reinforce each other. Hopefully, if we're doing them in a good way and have a healthy lifestyle, they help us promote the other pillars. So if we're getting enough sleep, as you're saying, we're able to help our brain avoid addiction, have that more ability to regulate our behaviors, and then same thing with our eating. Then that helps us with our sleep as well as our the social connections and the support. All of that is part of a healthy lifestyle. And I should throw in, since I'm big in positive health and positive psychology, is that there are these positive psychology-based interventions that boost our positive emotions and can be an additional pillar or an additional support along with motivational interviewing if someone is actually seeing a health professional to help support one to move away from these kinds of addictions.
Much. But I did like what you're talking about with the positive psychology, because I think that that's the other part is that's where it just starts building upon each other, that really to think that the pillars are just isolated. I think when we look back at this in maybe 10 or 15 years, we're going to just see how much more interconnected all of these really are.
Exactly. That is the point, is that all of these pillars is the perfect word, because they are the foundational pillars of a healthy lifestyle, or we need them all. It's
right.
To have a really solid foundation to build upon for our ongoing well-being. And what I love about it is that it also helps us to be, a commonly used word is resilient, but I also like thriving and flourishing. We use those terms in positive psychology. People quibble about the exact definitions, but it's a way of being able to weather the storms of life. Life throws lots of bumps our way, and so we need all of the foundation to help us through that. And so keeping that in mind, and for individuals who maybe are worried that perhaps they're drinking a little too much, or maybe there's a substance they've been taking occasionally, and they're worried, am I taking too much? When do they know that they need to get help?
So, I mean, with regards to alcohol, we tend to follow the NIDA suggestions. And so the NIDA suggestions are, for men, if you've had more than 14 drinks in a week or more than 5 drinks at an episode. For women, it's more than 7 drinks in a week or more than 4 drinks in an episode. Those are kind of those guidelines of saying when the drinking might be at risk. I think, from like an addiction perspective, like addiction psychiatry perspective, I think we look at it more of like, when is the behavior starting to affect? So is it that they're starting to have challenges doing their employment? Are they starting to have challenges maintaining, relationships within their friend circle or with their families? Or, I think that that function precedes sometimes the amount of drinking or the amount of some types of substance use. And I think that that's really an indicator. Um, when we look at some of the more harsh substances, the whether it's the fentanyls or the methamphetamines, some people would say never to use any of those. I have a number of people say that they know how to use it in moderation. I won't go into what is moderation versus never, but there's probably more on the harm reduction model than is probably more warranted. But yeah, I think really it comes down to what is the overall, how's the person functioning in their day-to-day life. But the other part of that, there's a lot of people that use this idea as like, well, they are quote unquote a dry drunk, or they are a happy drunk, or they are a functioning alcoholic. And I think the other part is, if you need to have the substance to be able to fall asleep every night, if you need the substance to be able to modulate your anxiety every single day, I think that also takes you out of that realm of being a functional whatever, and you're showing more dependency upon that because you're needing it to be able to have these abilities to cope. We were kind of talking about the positive psychology and having that ability to be happy, or that ability to, I think if you're needing that substance to be able to quote unquote be resilient, I don't think that then you're being resilient. I think you're being beholden to that substance.
Yeah, and of course, if someone is concerned, we would recommend that they reach out to a health professional to get some advice and be evaluated and get some help. But if someone wants to try something on their own, if they're not sure they're quite ready to reach for health professionals' help, are there other resources that you might recommend?
So I mean, I'm currently working in the Salt Lake area, so I'm just going to plug out a program that we have in Salt Lake, and it's called USARA. And when we talk about the connections, it's a group that's of peer coaches. So to be able to be part of this is most of the people, they themselves have had challenges with substance use. and they run basically a call 24 hours a day. They have groups at their facility. They even go into the hospital to meet with, a lot of our patients and try to be that warm, friendly person to have that connection. And I think that peer support group is so vital because it taps on connection. It taps upon giving support. And it might be less formal than, say, go to an AA or in an ANA meeting, or whatever that type of a meeting is. Even though those meetings are phenomenal, for many people there's a lot of stigma that's associated with that, or there's a lot of struggles with theology that might be affiliated with those, that I think like a good peer support organization would really be a good place to start. I think the other
And I
part
should say,
is,
in case the audience doesn't know, so you're talking about like Alcoholics Anonymous and
well,
Narcotics Anonymous. Those are the more formal groups you're talking about, and this
right.
you're recommending something more informal.
If your organization has it, then the other part is like, if there isn't something like that, then maybe it's having that conversation with that friend, family member, support, boss, somebody who knows you and says, hey, is my drinking getting bad?
Mhm.
What are you noticing about my behavior? Is it, and and hopefully the person won't be offended by the answer if it's, yeah, your behavior is atrocious, you know.
Well, yeah, it would have to be certainly a trusted, safe person to approach,
Right,
but
right.
and then we hopefully can be
Mhm.
open to that answer and that
Yeah,
advice and get the support we need to help make the decision. What are some potentially formal steps we need to do
right.
to help ourselves? So that's great. Um, any so I like to keep these podcasts short, so we'll wrap up this nice discussion on substance use. But are there any key takeaways that you'd like to share with the audience before we wrap up?
Yeah, I mean, I think this is the big one. I think that, so there's a study that and I teach my trainees this. I often ask, how many times does a person need to get a formal treatment before they get a degrees of sobriety? And the average is between 5 to 7. And why I say that is because if somebody does it once and fails or struggles of after a first or a second, it doesn't mean that the person is defective. It just really talks about how challenging these making these changes are. And it's this idea of like, let's have compassion. Let's, not everybody that we make a suggestion to as a healthcare provider is going to be able to just, hearing it once, make these automatic, life sustaining, life altering changes from that time going forward.
Mhm.
And I think individuals who are struggling, they need us as healthcare providers to be compassionate and warm and understanding that this is a challenge, and they may need to hear the message 2, 3, 5, 15, 20, 30, 50 times. And if we're doing that, we're still helping. Even though we may not be seeing that immediate change as a healthcare provider we would want to be seeing.
Yeah, so we need self-compassion on both sides. It's the health professionals themselves may get frustrated that they're not helping their patients. Um,
Right,
we as individuals or as patients who may be struggling absolutely need to embrace all those emotions. I like the word emo diversity, embrace them and have self-compassion and then gently move forward. So whether there's guilt, shame, all of that is normal part of the process.
right.
Failure, as you're saying, is a normal part of the process. Although we don't like to use that word, we want,
Well,
but
I mean, and
yeah, it's trying over and over again till we succeed.
right, and in my mind, just like what you're saying, failure only is when you stop trying. So
Yeah.
as long as the patient is still trying, they haven't failed. even though that's a word that they may use, or we as a healthcare provider may use because they weren't able to achieve mastery.
Exactly. And so to have the hope that's needed, and it's interesting in positive psychology, we have this area of what's called hope therapy. And I love hope therapy because it's a very concrete way to help us envision something more positive. So if we have a goal and there is a route to that goal or several routes to that goal, and that we have at least some idea, some level of confidence that with the right supports, we can follow that road, we will get to that goal. And so it seems that in substance use, we may need to follow several of those pathways with the right support to get to that goal. And so to step back and say, okay, I can lean on hope, even if this is my third time, my fourth time, my sixth time.
Right. Yeah. For both the provider as well as the patient.
Yes, exactly. So
Okay.
that's a nice, positive, hopeful way to end this discussion. So thank you so much, Steve, for joining us on this Lifestyle Medicine podcast series. And thank you to our listeners. And we hope to see you on another one of these short podcasts on lifestyle medicine. Take care. Bye-bye.